Deep within the heart of Africa, a silent killer lurks, often unnoticed by the world. It moves unseen, carried by the bite of a tiny fly, the tsetse fly, which transmits the deadly parasite. This is trypanosomiasis, a parasitic disease that affects millions of people across the globe, causing severe health issues and suffering. Trypanosomiasis takes two main forms: African trypanosomiasis, also known as sleeping sickness, which is prevalent in sub-Saharan Africa, and American trypanosomiasis, better known as Chagas disease, which primarily affects Latin America. Both are caused by microscopic parasites called trypanosomes, but they differ in their geographical spread, symptoms, and long-term effects on the human body. These diseases primarily affect impoverished communities in rural areas, where resources are scarce and healthcare is limited. Often these areas lack access to proper sanitation, healthcare and housing, making the fight against the disease even more challenging. The impact on these communities is devastating, leading to disability, economic hardship and loss of life, perpetuating a cycle of poverty and illness. Understanding trypanosomiasis is not just a matter of scientific curiosity, it is a crucial step towards alleviating the suffering of millions. It is about recognizing the plight of millions and the urgent need for effective control and treatment strategies to combat this disease. In the following sections, we will delve deeper into the world of trypanosomiasis, exploring its complexities and the ongoing efforts to control it. We will explore the specific characteristics of each disease, their impact on human health, and the challenges faced in controlling their spread, including the social and economic barriers. Join me as we shed light on this silent killer and the fight to protect vulnerable communities around the world, bringing hope and health to those in need. African trypanosomiasis, more commonly known as sleeping sickness, is a serious health concern in sub-Saharan Africa. This disease has been affecting the region for decades, posing a significant threat to public health and well-being. It is a parasitic disease spread through the bite of an infected tsetse fly, which is notorious for its role in transmitting this debilitating illness. These flies are found primarily in rural areas, often near rivers and forests where people live and work. The proximity to these natural habitats increases the risk of human-fly interactions. The disease is caused by a microscopic parasite called Trypanosoma brucei, which enters the human body through the fly's bite, initiating a complex infection process. Sleeping sickness is a major public health problem in 36 countries in sub-Saharan Africa. The widespread nature of the disease makes it a critical issue for health authorities. It is estimated that millions of people are at risk of infection, particularly those living in rural communities. These populations often have limited access to healthcare services. The disease has a significant impact on these communities, leading to reduced productivity, increased healthcare costs, and social stigma. Efforts to combat sleeping sickness are ongoing, but challenges remain in reaching remote areas and providing adequate treatment. Sleeping sickness presents in two distinct stages, the early stage and the late stage. Early stage symptoms often appear within a few weeks of infection. The first sign is often a sore or chancre at the site of the fly bite. This is followed by fever, headaches, weakness, and swollen lymph nodes. If left untreated, the parasite can cross the blood-brain barrier and infect the central nervous system. This marks the onset of the late stage, characterized by neurological and psychiatric symptoms. These can include confusion, personality changes, difficulty sleeping, hence the name sleeping sickness, seizures, and eventually coma and death. Diagnosing sleeping sickness in its early stages is crucial for effective treatment. This involves a blood test to detect the presence of the parasite. In later stages, a lumbar puncture may be necessary to examine the cerebrospinal fluid for signs of infection. Treatment for sleeping sickness depends on the stage of the disease. Early stage infection can be treated with medications that are effective in killing the parasite in the blood and lymph nodes. However, late-stage infection, where the parasite has invaded the central nervous system, requires more complex medications that can cross the blood-brain barrier. These treatments can be lengthy and may have significant side effects. Section 5. Beyond Africa, Chagas disease in the Americas. While sleeping sickness plagues Africa, a different form of trypanosomiasis affects millions in the Americas, Chagas disease. This disease is caused by the parasite, primarily transmitted through the feces of an insect known as the kissing bug. These insects are called kissing bugs because they often bite people's faces near their mouths. Chagas disease is endemic to 21 countries in Latin America, where it affects an estimated 6 to 7 million people. Poverty, inadequate housing conditions, and lack of access to healthcare contribute to the spread and persistence of Chagas disease in these regions. Section 6. Chagas disease. From mild beginnings to chronic complications. Chagas disease, like sleeping sickness, can manifest in different stages. The initial acute phase, which occurs shortly after infection, often presents with mild or no symptoms. Some individuals may experience fever, fatigue, body aches, or swelling at the site of the insect bite. However, if left untreated, Chagas disease can progress to a chronic phase which can last for decades. During this phase, the parasite can damage vital organs, particularly the heart and digestive system. This can lead to heart rhythm abnormalities, heart failure, difficulty swallowing, and an enlarged colon. Section 7. Unmasking Chagas disease, diagnosis and treatment. Diagnosing Chagas disease can be challenging, especially in the chronic phase when symptoms may be subtle or mimic other conditions. Blood tests are used to detect the presence of antibodies against the parasite. However, these tests may not be reliable in the early stages of infection. Treatment for Chagas disease is most effective during the acute phase. Antiparasitic medications can kill the parasite and prevent progression to the chronic stage. While these medications are also used in the chronic phase to slow down the progression of the disease, they are not always effective in eliminating the parasite completely. Section 8. Prevention is key. Protecting yourself and others. Preventing trypanosomiasis requires a multi-pronged approach, targeting both the insect vectors and improving living conditions in endemic areas. For sleeping sickness, controlling tsetse fly populations is crucial. This can be achieved through insecticide-treated traps and targets, aerial spraying, and reducing their breeding grounds. Preventing Chagas disease involves improving housing conditions to reduce contact with kissing bugs. This includes plastering walls, replacing thatched roofs, and using insecticide-treated bed nets. Raising awareness about the disease and promoting early diagnosis and treatment are also essential in controlling its spread. Section 9. The global impact. Communities in the shadow of trypanosomiasis. The impact of trypanosomiasis extends far beyond the individual level, casting a long shadow over entire communities. In sub-Saharan Africa, sleeping sickness disrupts livelihoods, hinders economic development, and perpetuates cycles of poverty. The burden of caring for those with chronic illness strains already limited resources. In Latin America, Chagas disease adds to the burden of infectious diseases, impacting healthcare systems and economic productivity. The stigma associated with the disease can lead to social isolation and discrimination, further marginalizing affected individuals and families. Section 10. Hope on the horizon. Research and the fight against trypanosomiasis. Despite the challenges, there is hope on the horizon in the fight against trypanosomiasis. Scientists and researchers around the world are working tirelessly to develop new and improved diagnostic tools, treatments, and prevention strategies. This includes developing new drugs that are more effective, easier to administer, and have fewer side effects. Research is also underway to develop vaccines for both sleeping sickness and Chagas disease. While a vaccine for sleeping sickness remains elusive, promising progress has been made in developing a vaccine for Chagas disease, offering hope for a future free from this debilitating illness. Section 11. A call to action, our role in combating a neglected disease. Trypanosomiasis, despite its devastating impact, often receives little attention on the global health stage. This disease, also known as sleeping sickness, is caused by parasites transmitted through the bites of infected tsetse flies. It is a disease of poverty and neglect, primarily affecting marginalized communities with limited access to resources, and healthcare. These communities often lack the infrastructure and support needed to combat such a pervasive illness. Raising awareness about trypanosomiasis is crucial to mobilize resources, galvanize political will, and drive research efforts. Public awareness campaigns can play a significant role in educating people about the risks and prevention methods. We must work together to support the development of new diagnostic tools, treatments, and vaccines. Collaborative research initiatives are essential to make significant strides in combating this disease. We must invest in strengthening healthcare systems in endemic areas and improve access to essential medicines. This includes training healthcare workers and ensuring that clinics are well equipped to handle cases. By working together, we can break the cycle of poverty and disease and create a healthier and more equitable world for all. Global partnerships and community collaborations are key to making lasting changes.